one of your loved ones have cancer, you may have many questions about COVID-19 and how it may impact you. To talk about these issues today, I have with me an inspiring Bollywood actor who is a cancer survivor, or should I say cancer thriver, an oncosurgeon, an oncologist, and an internal medicine physician. It's an honor to have them all today. I'm Dr. Priti Parekh. I'm an internal medicine and obesity medicine physician. This video is packed with information. Please share it with people who can benefit from it. Okay, so let's begin with a round of introductions. Shagun will begin with you. Dr. Shagun Bendre is an American board certified internal medicine physician and also a diabetologist. And Dr. Shagun, it's always a pleasure to see you, your ever smiling face.
Thank you very much, Preeti. I am very glad to be here. Some of the relatives had a history of cancer, so they all are going through the fear. So it's such a great pleasure to be here to discuss some of our anxiety and fears and find out some good solutions.
Absolutely, Shagun. Thank you so much. Thank you for being here. Introduce you, Sonali, although you do not need any introduction. Sonali, you're one of the finest actors of Bollywood film industry.
Let's skip that. Everybody knows. Move on. I think today I'm here because of the what you would call, I think it's a favorite word. It's a cancer survivor. So yeah.
Yeah, and you've gone through cancer yourself, and
we use the word thriver.
What's that?
We use the word thriver.
Thriver, survivor, fighter, conqueror. Sonali, one of your films, Hum Saath Saath Hai, is one of my favorite films.
Thank you.
And also because your name in the film is Priti and you're a physician.
Yes, I am. Was in that film. Yeah.
So, welcome, Sonali. So glad to have you. Dr. Toprani, he's a head and neck surgical oncologist. He's the director of Department of Surgical Oncology and director at HCG Cancer Center, Ahmedabad. President-elect of Indian Association of Surgical Oncology. And Dr. Mehta is a medical oncologist specializing in breast cancer and integrative oncology, currently practicing in Philadelphia. He currently serves as assistant professor of medicine at Cooper Medical School of Rowan University and the director of integrative oncology and practice development at MD Anderson Cancer Center at Cooper in Camden, New Jersey. He was also recently appointed chief of the division of hematology oncology. Congratulations. And medical director of Charles A. and Betty Bott Cancer Center at Holy Redeemer Hospital and Medical Center in Meadowbrook. Sonali, let's begin with you.
Yeah.
Life is less overbearing when you deal with one day at a time, that is, be in the moment. How did you come up with your hashtags, one day at a time and switch on the sunshine? And I live by these, especially these days, Sonali, I have to tell you, especially one day at a time.
You know, I have to remind myself of these hashtags continuously. And it's definitely a work in progress. But I suppose when I heard the diagnosis and when I figured what was happening, I suppose the clarity is of a different level at that point of time. And I really wish I could hold on to that clarity even now as I'm recovering, because suddenly those things were so clear, and there was no like today's kids love to say, no BS, no bullshitting. Everything was just all the fluff was off. And it was just so right there and narrow, and it was just the path. And so things just came through at that time because it was just so clear. And this is something I do wish that we don't need to, and I do hope that we don't have to go through what I went through to realize it. It is something that we should be using regularly on a regular basis. But it's not easy to do that, because as soon as I'm back home and I'm in a comfortable environment, I keep forgetting it. And I think this pandemic that we are going through is a reminder. It was just a reminder for me to take one day at a time. And just when you think that, okay, this is done, we are all set, you're never set. There's always a different plan of action that's going on. So let's not just complicate life too much by making too many plans, is how I'm looking at it now. Really easier to say it and easier to make a hashtag, but it's much more difficult to actually live it. It's very difficult to actually kind of follow that path, because how do you not make plans? I mean, we live on hope. So we say that you should have hope. And I think planning for future is kind of like having hope. So in a way, you say you should live on hope. You should hope for the best, etc. But when you don't plan for it, then how do it's like, it's a confusing situation. So literally, where is the line? Where is the balance? And then again, you realize that life is all about the balance. And then finding the balance is never so easy. It's a tightrope walk, and you have to focus on it all the time. The moment you lose the focus, you fall off that tightrope. So right now I'm on the tightrope, trying to find that one day at a time.
Correct. Yeah. Thank you. Thank you for sharing. Thank you for your insights. Dr. Mehta, this one's for you. The risk of being immunocompromised is typically highest during the time of active cancer treatment. Is there an increased risk of COVID during this time? So that's number one. And number two, those who've been through chemo and radiation, so those who've had history of treatment in the past, are they at risk too?
Mm-hmm. So I think the way I sort of look at cancer treatment in COVID is we sort of divide it into two categories. There's the risk of acquiring the infection, and then there's the risk, if you get the infection, of actually having a more serious illness. So, sometimes patients believe that being immunocompromised is this monolithic thing where everyone is the same. And I have patients on one end of the spectrum who have minimal suppression of their immune system, and then patients on the other who are dramatically suppressed. And so part of this is talking to your doctor about what it actually means. How suppressed are you? Mm-hmm. But generally speaking, we have about 10 societies that have come out with guidelines on COVID and cancer. And they have all said that to some degree, you're at a little higher risk of getting it. So we are really careful at our cancer centers, practicing all of the common sense, criteria. Mm-hmm. And your second question was about...
those who've had treatment in the past, they're done with chemo, radiation, surgery, and,
mm-hmm.
they're cancer-free right now. Are they adding?
Yeah, that's a really common question we get. So I have patients that I may not have seen in the last year or two because they're 10 years out from their treatment, and they will call and say, am I at higher risk? And while we don't know the clear answer, I would say that objectively speaking, when we look at blood work and we look at people's treatment regimens, for the most part, if you're past your treatment, mm-hmm. more than maybe 6 months past your treatment, the likelihood that your immune system is still suppressed enough for you to be higher risk is going to be lower.
Mm. Okay, that's great to know. Yes,
mm-hmm.
Sonali, go ahead.
How low? Because this really affects me, and I would love that answer.
Yeah. So, I think the immune system. So the immune system is a really complicated series of cells and proteins and cytokines. And when we do these objective measurements on people who've been through chemotherapy and radiation, what we find is, there's blood counts we can look at. And when you treat cancer, you see that blood counts usually recover, and patients realize, they know their white blood cell counts and their neutrophil counts and all these white cells, and those recover usually, within a few months of completing treatment. But when we do studies on people in a more sort of refined way, looking at how these cells actually work, not just, I always tell patients, not just the number of soldiers, but how well trained they are, we find that there is a little bit more delay. But essentially, in China, because they've had sort of, if we can call it the longest experience with COVID, there actually is data looking at patients who have had cancer and patients who are going through cancer treatment. And what they're finding is they didn't really see an increased risk in patients who were past that 6 month to 1 year point.
For those who are at increased risk, any specific precautions besides, of course, social distancing and hand hygiene and all? Anything additional? Because this is a common question I get asked by cancer patients. Okay, what else can we do?
Yeah, and I like using the term a patient with cancer rather than cancer patient. But our patients, they're in a unique situation because they're coming often, radiation patients are coming every single day to a cancer center where they're being exposed. Chemotherapy patients on chemotherapy are coming, sometimes once a week, sometimes twice a week to these places. So part of the precautions are not just what they do and what they practice at home, which by now, I think it's almost sort of ad nauseum. People have, sort of adopted or at least understand some of these guidelines, the hand washing and the 6 feet and all of those things. But it's more about, I think, understanding where you're going. So when you go where you're going to be at your cancer center, talk to your doctor, and not just necessarily to the doctor, but talk to the staff. Talk to the people that you see. We have at the MD Anderson Center, from the valets who park the cars to the person who cleans the room after a patient. I mean, they all are trained and they've been sort of briefed on exactly what the process is. And you want to feel comfortable that your cancer center is doing that.
Right. So Sonali, given that you have a history of cancer in the past, anything that, any of these strategies that you're following, any additional precautions at home, and how do you involve your family members to help you out?
Well, I have a mother-in-law at home who is diabetic and has a heart condition. So in any case, I think in the house, you have to be more, I feel is high risk. And so there are certain precautions that you would take for her. And I just think it's not a bad idea to follow the same precautions because I might not be as high risk as her, but there's no harm in being careful. That's not going to harm anybody. And like Dr. Mehta said, there is certain amount of common sense. I mean, it is a virus that you don't know things about, that you don't have certain treatments about. And rather than if you have the luxury where you can social distance and you can stay at home and you don't need to go out there in the public, then just make use of that. And I would say that in a country like India, where there is already so much pressure on the various systems, I don't think you need to add on to it when you have the luxury of being able to take care of a few things. I mean, there's so many people in the country today who don't have the luxury, who can social distance. They don't have the option, and they don't. So when you have the option, I think the least we can do, or I can do right now, is to keep out of trouble. And so you don't add on to, what already the healthcare workers and doctors and everybody are going through. They have their hands full. Let's just not add on to it at this point of time. And so I would say that, yes, let's use the common sense and let's just sit at home. It doesn't matter. Oh, you know what, for 2 months we sat at home and it was such a, we needn't have done that. Fine, that was 2 months of your life and it's okay. None of us knew it. But what if 2 months later you come to know, oh, that was the best option? Then you've done it, So I would say that when you're not a medical professional who has too many, I mean, you don't have that much of knowledge, then just use the common sense. Yes, keep your immunity up. Do the basic hygiene, which is important, and try and just keep out of trouble, as I would say.
Thank you, Sonali. Thank you for doing your part, and thank you for this wonderful message.
And Priti, I would like to add here, there are some of our patients who are very anxious because they are going through the treatment, but their spouses are the essential need workers, and they have to go outside. So in those conditions, we have seen a lot of anxiety among patients, and they have been asking us how to do and if they have to take extra. So definitely from their part, they are taking all the extra precautions, but definitely it gets very challenging for them even for the family member who is working and going outside and coming back home to the patients who are sick. So it definitely gives a lot of anxiety and fear for the families. But again, taking extra precautions are the best way, no matter what. I think that's the best they can do, and staying home as much as possible.
So basically, Priti, what we need to teach general public, for lay people, laymen, and for patients in particular, is to educate them how this virus spreads through one human to another. So basic things like what you all have been talking about is hand hygiene, and maintaining social, I would say, physical distancing, and the etiquette of sneezing or coughing, and wearing a mask, very important. So these are all the things. So even at home, probably I would tell my patients who have undergone some sort of chemotherapy or radiation or something like that to, self isolate them in at home also, so that, because they've been visiting hospitals frequently, and you don't know whether they are taking something back home.
Correct.
And there may be, as Sonali said, there may be some high risk elderly people at home, and you might not get anything, but you will easily transmit
Pass
this
it on.
virus to somebody who is a high risk, and that can cause some problems. So basic things, common sense, etiquette of sneezing, coughing, hand hygiene, uh, physical distancing, this is what is required.
Right. So just basically that means that we have the tech today. I'm technologically challenged. It comes as it's very difficult for me, but I think this is what is saving us at this point of time. And like I have a 14-year-old son, and the thing is that normally he would probably be allowed to game only on weekends and certain amount of hours. So now the thing is that, okay, you need to be in touch with your peer group. You need to have fun also. So on weekdays also 1.5 hour he's getting on weekdays also to be, gaming. So we all have to make those adjustments because they are going to be teenagers and they are going to want to do a few things, and peer contact is also important. So then you kind of, because these were the protocols in place. So the thing is that, look, you can't go out and you can't meet your friends right now, but instead of just the week, you know what, on weekdays also you can have that 1.5 hour where you can spend, because they're on their headsets talking to their friends and they play the game together. So it's just a sense of community. And I also feel that at any point of time when you're going through something and you're stressed, that sense of community always is something that pulls you through. And especially for teenagers like 18-year-olds, 14-year-olds, the peer group is very important. And I think that we should just encourage them to use the tech more, and kind of give them the space to use the tech more, I suppose, would be the answer in these times. Exactly what we were doing before this.
Yeah, that is so true, Sonali, which is why we like to use the term physical distancing rather than social distance.
Social.
When you said that, it was so right. I think that's the term I'm going to use now also. That's more important than it's not social distancing, it's physical distancing.
It's physical distancing.
Correct. Correct.
Perfect. Yeah.
Dr. Toprani and Dr. What's that?
I said I learned the new term.
Yeah. So Dr. Toprani and Dr. Mehta, this one's for both of you. Some cancer treatments are on hold, including some elective surgeries and even routine surveillance like PET scans and CT scans are being postponed. And that is anxiety provoking. Again, that's one of the common questions I get asked by patients because, they're nervous. Dr. Toprani, let's start with you.
So you have asked a very pertinent question because in this lockdown, particularly in a city like Ahmedabad, when there's a strict lockdown, it's difficult for patients to travel also. What we do is we triage our patients when we get their information prior to their appointment, physical appointment, when they come to our hospital in the outpatient department. We get most of the reports by WhatsApp or email. And then we look into that and we figure out whether he's suffering from a early curable cancer or he's suffering from a advanced incurable cancer. What is his age? What are the morbidities? So we would divide those patients into young patients, fit patients, no morbidities, early stage cancers which are curable and where surgery is the only option available. We give priority to them to operate. There is another group of patients where they are very high risk, for example, 70, 75 age, advanced oral cancers and with hypertension, diabetes and other comorbidities. And they are borderline operable, and whatever you do with them, probably their cure rate or prognosis is poor. So those patients, we would probably investigate further, make sure that they are not having a metastatic disease, and then probably look out for an alternative therapy, non-surgical therapy, till we can see how they are responding to this chemotherapy particularly, And if they respond well, later on we can take up for surgery. But we have to talk to the patients. We have to balance the advantages of delaying things for them in view of the risk of getting corona, because we need to really balance this out, and we really need to make them understand what is good for them.
Dr. Mehta, do you want to add?
Yeah, I think to further that point, it's, there are a few times in patients' lives that anxiety is higher than with a cancer diagnosis. And we know when we do these psychological assessments on people, that often they have post-traumatic stress disorder or PTSD-like illness. And this is where I think the medical community probably needs to do a little better. We have medical data on stage 0, 1, 2, 3, and 4, but a patient that comes in may not see it that way. Every patient, I only do breast cancer, but I know patients that have PTSD who have stage 0, and patients who are stage 4 who are absolutely thriving and doing beautifully. So I think we sort of take that into account, that they're already coming into this with dramatic changes in their psychosocial well-being. And then we add this additional burden of this infection. And so the way I sort of break it up is, and to Dr. Toprani's point, this is such a individual, unique situation for each patient. But we sort of look at what is cancer treatment. Cancer treatment is essentially 3 things. It's surgery, it's the broad term systemic therapy, which is, chemotherapy is part of that, but so is everything else we do in medical oncology. And then there's radiation. Mm-hmm. And while sometimes a surgery can be delayed a few weeks in a patient who might have symptoms or whatnot, chemotherapy can sometimes be delayed a couple weeks. Radiation often can't be, if you're in the middle of radiation. We got a patient recently in that situation, in the middle of radiation. What do you do? Because if you stop, you sort of change their whole plan around. So I think each and every patient, we have all these guidelines, which have been very helpful, I think, for the medical community and the medical staff. But in the end, it goes down to the treating team that's taking care of you, to the physician, to the nurse that's there, to the multidisciplinary team, to the patient, and saying, what makes sense here? Is it more dangerous to wait, or is it more dangerous to treat? And from there, we then make the best judgment that we can.
And Shagun, a lot of screening procedures, cancer screening procedures are being deferred too, right?
Mm-hmm. Yes, Priti, again, it was very well explained by Dr. Toprani and Dr. Mehta that, again, we are weighing the risk against the benefits when deciding whether one should get screened. And it's very easy for those patients who are healthy, and we can delay the procedures easily, and they understand, like pap smears or mammograms. But in case patient has symptoms like positive blood in the stool or lump in breast, then delaying probably is not an option. And in those cases, we are not even talking about screening. So being a diabetologist, I have seen unique challenges in the patients who has chronic illnesses like poorly controlled diabetes, high blood pressure, or heart disease. And we are currently facing pandemic on top of the epidemic of diabetes itself. So we all are very well aware that diabetes and cancer connection is quite statistically significant. So delaying screening in these patients has been challenging.
So if I can add something more to what Shagun, you mentioned, when you use the word screening, we basically use it for asymptomatic patients going for regular checkups for their mammography or pap smears or PSA for prostates and all, or an ultrasound. So if patients are symptomatic, and if your family physician or your treating doctor feels that something is wrong, then this patient should not delay seeking the help from a cancer hospital or a cancer surgeon or a physician. So that is very important, because further delay in seeking advice from cancer surgeons or cancer physicians can increase the problem, and the stage migration happens, and then the prognosis changes. So they should not delay seeing the doctor if there is something suspicious.
Time for some fun talk. Sonali, this one's for you. Can you share the recipe of your famous immunity boosting smoothie?
Yeah.
And I personally think you have chosen all the right ingredients. Let's hear from you.
For all you know, it works. For all you know, it doesn't. Maybe it's a placebo, but whatever it is, it saw me through my chemotherapy also. So there were certain protocols that I followed throughout, because early on, what I understood was that once I get through my chemo, the idea was to get the blood count to a certain level, and that's when I would get my next dose of chemo, or the next dose of chemo would get pushed. And if that got pushed, that means delayed treatment, that would mean extended treatment, that would mean going back home was further away. So the idea was what was the minimal time, and the idea was to attack that as a goal and to try and achieve and not miss the date, so that I don't miss the date back home. So there were certain things that were really, like doctors have mentioned, it was just common sense. And one was that the good thing was that I could step out, and I could, the doctors there said that, you can go for a walk and stuff like that. And then there are the flu season, and there is all these various seasons that keep coming in. You might take a flu shot and everything, but the idea being that even if either a virus or a bacteria, it's going to go in, other than the cleaning of your hands and everything, even if it is there, it's going through my mouth or through my nose, it's not going to directly go in. It's going to take a certain amount of time to reach my lungs or down. So the idea was to do inhalation. So I would just take inhalation every day. That's, you're sterilizing your sinuses and your nasal passage. And I would take the steam in my throat also. And the idea was I did not need to, touch wood, I did not need to take antibiotics at any point of time through my chemo. I could stay off them, which also gave my body the time to kind of heal and to focus on what was needed. Because the moment you need to take antibiotics, you're again, bringing your gut health down further and, just getting that balance back. We all know the consequences. So the idea was to try and stick to just the chemo and not add to what you needed to fight against, not to add the smaller things to it. So I did that. And of course, healthy eating is the rainbow. Get your fiber and the vegetables and the fruits and the protein in. And so that was the smoothie that I devised. And then at that point of time that, you've heard your grandmother say it, your parents say it, that, the amla works, the turmeric works. And, my naturopath at the hospital also was telling me all these various things. So then, if you're going to go through these little things every day, so I just figured that make a protocol, put everything in one go, just start off your morning with it. So you're done with what you need through the day in that one smoothie. And definitely these are all the things that you can use to supplement it, in the sense of help you with your healing process, boost up your immunity, help your body fight it better. But you can't fight the actual disease with it, I feel. But, it can definitely help you recover and get back to your older self faster, is my understanding of this process. Correct me if I'm wrong. I mean, all the doctors over here.
Yeah,
well, I'd like to hear it from you, because as an integrative oncologist, I think you talk about the effect of diet and nutrition on our immune health.
Yeah, I think I completely, what Sonali said makes the best sense for patients. I think, and I think in India, people are doing this more than here in the States, which is we tend to have this dividing line between conventional medicine and, various terms, holistic, alternative is now a bad word, so we say integrative, but, there really should be both. And so the way I treat patients is I am a conventional medical oncologist. I give the chemotherapy that's needed. I give the hormonal therapy, the radiation, send people for surgery, etc. But when they're going through this, exactly what Sonali said, I tell them, here's the things you can do. So I realized this sort of early on, that I would see patients and I would give them these plans, these complicated treatment plans, really detailed information, but then they would ask me the simplest questions about what they should eat and what, is there a supplement that might help them get through? And I had no answers for this. And so this is why I kind of got on a little bit of a quest to find out, and doing, a lot of research to try to figure out what is evidence-based, because the other side of this coin is, especially in the information age we live in, that there is a lot of information out there that is dangerous. And we're seeing it during COVID, but certainly in the cancer world, you know, in breast cancer, 90% of patients are doing some sort of, you know, alternative or integrative therapies. Now, a lot of that may just be, you know, eating well. I do make a smoothie every morning, although I call it a green drink, but you know, that's great. But then there's people, I had a patient a few weeks ago who spent her entire life savings going to Mexico and getting treatments that unfortunately not only did nothing for her cancer, but she ended up with a later stage problem. So it's tough, I think, for, you know, the medical team, the cancer care team, to try and advise people. But in this era, every physician needs to be aware of the things that Sonali was talking about. What makes sense for people to have in the morning? What sorts of things should they avoid? The American diet, the SAD, the standard American diet, is a sad diet. You know, lots of refined flours and sugar and processed foods and saturated fat and lots of calories and red meat. And, you know, these things just, we know over and over, they've been shown to not be helpful. But certain people in certain places sort of get it more than others. And just I can add, when I emigrated to the States, I was 6 years old, and I distinctly remember in the little apartment in New York City, my grandmother was with us, and every morning or every night, she would make me drink milk. She would crush some almonds, and then the turmeric was added in, and I hated it, but I think I know now that it helped.
Yeah.
So also, this is a very common question asked by patients, whether I can follow my grandma's advice or what. And I very honestly tell them that it is not going to harm you. Why you should stop it? There is no reason to stop it. Mm-hmm. And if the patient feels better with that, why not? At the same time, apart from nutrition, we tell our patients to do some sort of a yoga or a pranayam, and that really helps them. Creating a positive energy within is really a good immunological booster, and that really helps. We don't know, we have no evidence, but patients feel better, and they are able to face these problems very positively.
And Dr. Toprani, there's actually, you know, more and more research coming out that stress, the effect of stress on immune cells. You probably, you know, Dr. Mehta, you know, feel free to add to this.
Yes, absolutely. I was told that exactly that by my doctors, that, you know, your don't have the sugar right now. I mean, I'm completely off you know, the sugar and etc. Like we all know here, no sugar at all, no processed food is out. But there were times when my integrated medicines doctor told me that, you know what, if you're feeling the urge for it, I would rather you had a spoonful of that sugar rather than stress about it, because that stress is worse for you than that sugar at this point.
Right.
So I just knew how horrible stress is on human body. And so what Dr. Toprani is saying is so important, because, you know, you're going through, your doctors are giving you the treatment that is necessary. I don't understand that. I don't understand those drugs. And that's why you've gone to your doctors. They're giving that to you. Now, what are you going to do as a patient? As a patient, it's your what you consume and what you consume through your mouth, through your eyes, into your brains. Everything matters. So your yoga, pranayam, thinking positive, eating good food, it's going to help you build an immunity and take you through the harsh treatment. So unfortunately, at this point of time, these are the only treatments that are available and that can get you through cancer. So till you can come to a point where there is not such a harsh treatment available, this is our only option. So this is what I feel as patients we can do to help our doctors is, you know what, think positive, don't be a whiner, don't be a complainer, eat and drink well, cut certain bad foods out. Yeah, I miss it. Too bad. Just let it go. And, do your exercise, get your heart rate up and, think positive. And these are the things that you can do to help with what the drugs are doing. In India, Indian food does have the use of spices. Now, as long as you eat it the way your grandmother made it, so there is a healthy way where you steam the vegetables and not deep fry it and, add too much of it and everything. if we actually follow what our grandparents and great grandparents used to, the lifestyle they used to lead and the way they used to cook that food, then it definitely, the Indian food is one of the best options to have right now, as long as you use it the way it was cooked at that point, and not with all the processed food and the lot of frying that happens. So in the sense, as a cancer thriver, as you said, I would like to add that I have gone back to what my grandparents were doing, and I've actually started eating those portions, and I've started eating that kind of food, the vegetables that are cooked in that way, not overcooked, cooked
Yes.
right. Yeah, so
Yes.
that has.
Did you miss Indian food while you were there at Memorial?
I ate Indian food every single day. I lived on Indian food.
So I would like to add, I would like to add on a point here about the plant-based diet, because plants, being a integrative nutrition health coach as well, I counsel my patients, even who are healthy, on switching to plant-focused eating pattern that is actually has proven to have a lower cancer risk. So some strategies, as we all discussed, is most important is to have a low carbohydrate diet. And it's really very much important in this unprecedented time, because we all are at home, and a lot of people and a lot of my patients who come and talk to me, and they say that, because of lockdown, I have been eating a lot of processed food or high carb, and my activity has not been that much. So again, I think I would like to reemphasize that taking a low carbohydrate diet is very important right now. Like in India, like sweets, we have still all the sweet shops open, and just thinking to get the sweets and eating those is not a good idea. Basically, just focus on whole grains than the refined foods. Take at least 2.5 cups of vegetables and fruits. And I think the smoothie idea is the best, because we don't realize to include it in our day-to-day diet. So, and exclude a lot of starchy foods like potatoes, especially everybody's favorite, those samosas is like fully carb loaded. So target on variety of foods, not the amount. It's more of the variety that are rich in vitamin C, carotenoids, like carrots, tomatoes, spinach, etc. And vegetables and legumes from family of onion, garlic. So they all are very beneficial. So I think taking care of the nutrition is most important right now.
Again, you are talking to three gujus on this panel, and we are all from Ahmedabad. So we are all fond of sweet and doklas and theplas. So it's difficult for you to convince the panel.
The smoothie, for people who do, so I readily admit to patients that it's hard. Vegetables are not something I've enjoyed in my life, but I do the smoothie for that exact reason. So I can get all my vegetables in the morning. But I found 3 things in a smoothie that makes it taste good, which is lime, mint, pineapple. If you add those 3 things to any smoothie, it makes it taste good.
It will make it better.
Sweet tooth, a little manuka honey.
Or dates work really well too.
Dates are too, yes.
So we're running a little over time, so a couple of quick questions before we wrap this up.
Sure.
Sonali, this one's for you. What are some of the tools in your toolbox for a challenging day? You talk about, you talk about little things that pick you up. What are these little things?
Even when you don't feel like, if the moment the exercise that I do, and which invariably starts working for me, is that you just sit down and you're feeling low, and you start using the muscles on your face, where you just start moving them. And the movement of that muscles, actually you start smiling when you start doing that. And the moment you start smiling, it changes your state of mind. So the idea is to get yourself to smile. So one is, when you do this, when you say that, okay, acknowledge the fact that you're hitting the low, and you start making those muscular, physical movement of smiling. And the other is to read happy things, see happy things, meet happy people, and just, so that it keeps the smile going. And just try and keep, even if it is not the outer, inwardly keep a smile on. And if you can achieve that, I think that always is a great pick-me-up.
Yeah. Wow, great tips.
That's such a great tip.
For patients going through cancer, and especially around this time of pandemic. Dr. Toprani, what are some of the resources for emotional support? Because it's not just physically, right? They are
Absolutely,
yeah.
absolutely. There is a sense of fear amongst not only the general public but more in cancer patients. The mental status of these patients is very important, and the counseling by one of our psychological person in the hospital. She talks to the patients and she allays their fears, and she clears some of their doubts. It's just somebody needs to listen to them. That is very important. Doctors, most of the times, they don't have time to go through for 15 to 20 minutes of sessions with the patient. So we need someone to talk to them. Then she reports back to us and she tells them that this patient or the relative has such a concern, and we try to advise them how to go about it, what is the prognosis of the patient, and then she goes and gives the correct picture, and then everything settles down slowly and gradually. So this is what you asked is a very important question. Patients, they have a lot of myths in their mind. We need to break these myths, and we need to give them very clear understanding. We need to educate them. We need to be empathetic with them, and we need to be very loving to them, because they not only suffer from a major crisis in their life, but the psychological problem, it takes its toll. So this is very important.
Thank you. Yeah, thank you for sharing. By the way, Sonali, I have to give you 10 on 10 on creativity. You can't go out to walk your dog, and I heard that you taught your dog to walk on the treadmill. How did you do that?
Well, actually, that's when I came back from my treatment, and obviously I was immunocompromised, and I didn't want, you know how Mumbai beaches can be, and so she loves going there, and be able to do that, and yet she needed her exercise, and I do feel, like you said, pets like children are also a great way to pick you up. It helps you, brings a smile on your face. They're amazing, especially dogs. The comfort that they can give just by being around you, I feel, kind of helps you recover faster. So I had missed her so much, and I definitely wanted her near me. And if she went out for these long walks into the beach, and then I wouldn't be able to hug her and have her in my bed. So the idea was to just clean her up, get her the exercise on the treadmill, and I could sit there next to her, talking to her while she was doing her walk. And she's a darling, and it was very easy to train her. Of course, food was a big factor, so I was giving her treats and getting her on the treadmill and then keeping her on there. But slowly, as time went by, I could take the treats away, but she was trained by then.
So Sonali, can I ask you a question? Like you have gone through everything. Now in this COVID era, you must be interacting with some of the patients who must be contacting you, taking your advice. What are their questions to you? What are their concerns? Have they opened up with you with whatever we have not discussed today? Is there anything specific that they ask you about cancer, particularly in this COVID era or something like that?
So, not just in this era. What I found when I put the post out, I was just letting everybody know that this is what it is and this is where I'm going, because I was doing a show and I had left midway through the show. I really didn't want some weird gossip around it, and how the kids are on the internet and parents are going to get some weird info. So I just wanted to be very clear as to what I put out. I didn't want there to be a different. I wanted to own the narrative, basically. That was the point. I didn't want it to be told in a different way. So when I put that post out, and that was it, and then I thought I was done with it. But the response we got when I put that first post out was kind of really shocking. I didn't realize that. What I realized was that every strata of society was afflicted by it, and it didn't matter if you were in a small town, a village, or in a city. It didn't matter if you were rich, middle class, or poor. It didn't matter what gender you were. There was no age thing. There were different types of cancers, and so we just club it in one thing, which is a cancer. But every cancer is literally like a different disease. I mean, you wouldn't go to a heart doctor for a breathing problem, and different cancers are exactly like that. You need to understand that they're like different diseases, literally, while they come under the cancer category. So, and the other thing that I realized was that there was certain kind of, I don't know why, there was a certain stigma attached to it, or God knows what it was, but there were a lot of people who were hiding this fact. And they came out and they said, oh, we went through it 3 years back. I've still not told my parents. I've still not told, basically what you realized was that people were internalizing it. They were hiding it. And what I realized was that just the fact that I had shared it, and because I had this huge support system around me, be it my friends and my family, and when I just imagined not having them around me, this whole journey would have been, I don't think I would have been able to go through this journey the way I've been able to go through unless I had that support. And so my heart just broke when I realized that there were so many people who were going through this horrible journey all alone and hiding it. And that's when I decided to go through and share my journey, because I've always been a very private person. So this is not me sharing what I go through. And, you know, in a way, sharing what my family is going through has not been me. So this was a call that we took, and my husband was, and my son were there with me. We had a chat about it, and they were supportive about it. I said, because, you know, when I shared that, them being a part of my support system, a lot of their stuff is going to be out there in the public. But we felt that we needed to share it, because, you know, I needed to get this conversation going, because I still till today I don't understand, why would you want to hide it, and why would you not share this so that people can come and give you love and support you. And the other thing that I realized was that it's a very hard time for caregivers also, especially the primary caregivers, because, you know, the patient is still getting the attention because they're going through the disease, but the caregiver, a lot of times, especially if, you know, sometimes it's a very hopeless situation and they feel very helpless. And I think when you can talk to someone, it lightens their load, and there's a lot that they are bottling up also. So yes. Obviously I'm not a doctor, and that's not something that I can help with. So like you said, counseling and talking to someone, taking the help, reaching out and going and asking for help is very, very important. I reached out. I went to what you would call an onco-psychiatrist or counselor, and I did do the counseling, and it did help me, because there's so many things, questions, which sometimes it's not like you need an answer for them. Sometimes you just need to voice them, and you just need somebody to hear them out. Exactly. And I'm hoping that that's what I will be doing. And if I can, at any point of time when they call me in and want to talk about it, I think that's the least I can do.
But I'm going to end with this quote by Eckhart Tolle. This is a book we're reading in my book club that I'm part of. One of his books, Power of Now. If you get the inside right, the outside will fall into place. Primary reality is within, secondary reality without. And so I guess it's up to us how we face this new reality.
Well said. Yeah.
My message to all the cancer patients or patients with cancer, that, you know, you need to remain positive. You maintain your nutrition, moderate exercises, and just follow the physical distancing and the hand hygiene more strictly than everybody else, and that will keep you safe throughout. And this phase is a temporary phase, and this is going to pass.